Hi, my name is Emily. Today we're going to be doing our IV start with the IV push skill. So let's get started. First, we're going to check our medication orders with our physician orders. So we have our patient Wanda Chi, MRN 872923001, MRN 872923001, date of birth 092020XX, 092020XX, no known allergies. Start IV now at 0900, start IV now at 0900. 0900 is for meperidine 50 milligrams slow IVP over 2 minutes now. Meperidine at 0900 50 milligrams slow IVP over 2 minutes now. Okay, so we checked our orders and we're going to be doing our 5 drug rights because we're giving a medication. So the right patient, right drug, right time, right dose, and the right route. So we're going to be doing our first check. When we check our orders, we do our first 5 rights. So we're going to be doing the right patient, Wanda Chi, right drug, meperidine, the right time at 0900, right dose would be 50 milligrams, and we will calculate that to milliliters. So I did it right here, 0.5 mLs. And then we are going to be doing the right route, which is IV push. So yes, so we checked the allergies, no known allergies. We calculated it, and make sure you're not going to be pushing it in too fast. So we're going to do that. So we're going to pull it from our med room, and we're going to do our second check there. So, go into our med room, pull our drug, meperidine, okay, 5 rights. We do the right patient, Wanda Chi, right drug, meperidine, right time, 0900, right dose, 0.5 mLs. And then because it says 100 milligrams per ml and 100 milliliter, and 1 milliliter vial, and then we're going to be doing the right route, which is IV push. So that's our second check. We're going to check the expiration date on the medication and the supplies. Everything is good. Nothing is expired. Everything is up to date. So we're good. We're going to wash hands, don our gloves, and introduce ourselves to the patient. So, knock, knock. Hi, my name's Emily. I'm going to be your nurse today. Let me just wash my hands and don my gloves. Okay. So we're going to ask for her name and allergies. What is your name? Wanda Chi. Have any allergies? No known allergies. Okay, perfect. We're going to be starting an IV on you today and giving you some pain medication. What is your pain right now? Patient states pain is about an 8. Okay, perfect. We're going to give you some pain medicine and relieve any of that. Do you have any questions about what we're going to do today? Are you okay with what we're going to do today? Patient states yes. Okay, perfect. Okay, patient is in comfortable position. Bed is raised for my accommodation, and we are ready to start. We're going to check that the arm that we're going to be doing it on allows venipunctures. So, okay, so no mastectomies, no dialysis done on that arm. Arm is good to go. There's no dry skin or anything. We're going to gather our supplies, and we already did our calculation. I'm going to show it again. So it says 50 milligrams. That goes to 0.5 ml. So we're going to be giving that. Okay, so we have our IV start kit, alcohol pads, tape, and 2 flushes, our IV catheter, patient, our extension set with our flush, and we have we have our syringe. And so we are ready to start. So gather the supplies. We got pieces of tape right here already on a sterile area. And we're going to prime our extension set. So before I did this before, but the video shut off. So I'm priming the extension set. You're going to make sure it's not closed. And then you kind of want to see there's some drippage. Okay, so it's primed. No air bubbles in there. So you're just going to prime that and make sure it's good. Okay, don't touch the tip, and then make sure nothing gets contaminated. And then there we go. No contamination. So now we're going to put on our tourniquet, and 3 to 4 inches above where we're going to stick the patient. Okay, so make sure not to leave it on for more than 1 minute. So you kind of want to move pretty fast. Okay, so there we go. Okay, so now we put our for no more than 1 minute. Okay, I'm going to leave these gloves on. I would change them, but they're not dirty. I haven't contaminated them. Okay, so now we get our IV catheter. We're going to use our thumb and finger. And so we're going to do bevel up. We're going to use our thumb and middle finger to hold it down, but we're also going to just move it up with our index finger. Okay, so here we go. We're going to make sure it's bevel up. Okay, so now we're just going to go in. We're going to pull in skin taut at a 15-degree angle. And there's this little thing that you're going to push up there with. Okay, make sure skin is taut. Okay, 15-degree angle. And we're going to just advance. Perfect. Okay. All right. So we're just going to, there, that click, that was that needle. Okay. There we go. IV is in place. Sharps container. Okay. IV is in place. Okay. Don't touch the insertion tip. Everything's clean. We're going to lock the needle in place. Remove the tourniquet by a pull. Okay. And then we're going to connect the extension set. We don't contaminate the tip. Okay. So we're just going to connect here. Okay, perfect. Hold it in place. We connected it. All right. So we are good. We connected it. And we replaced the little tip. Okay, so perfect. It's going to look like this. All right. Now we're just going to flush 2 mLs and check for any puffiness. Perfect. It's great. Now we're going to secure the IV. So we're just going to hold it in place. We're going to put it under. We're going to use our butterfly method. So stick the tape under the cath and make an X across. So be careful not to move it. Okay. So make sure not touch the insertion site. You're going to just want to put it over the blue. Okay, perfect. All right. There we go. We did a cross. Now we're just going to put one in the middle of our clean tape across the blue. Okay, so perfect. And now we're going to do our Tegaderm over that. So everything is sterile. Everything is sterile. And we're going to put our Tegaderm now on it. Okay, so we're just going to take this off. And it comes with the label, so you're going to want to label it. And then you're not going to want to make sure you put the Tegaderm over where you're not blocking any of the IV. So here we go. This is going to go over the insertion site, but that's normal. Okay, so here we go. Should look just like that. Perfect. Okay, so now we're just going to label the IV. We're going to date, time it, and okay, so now we're going to just put the, okay, and put on the side, and we're going to just put it on the side of the dressing. Date, time, initials, so the nurse knows when to change it, and now that's our IV. Now we're going to be doing another med check, and so now we're going to check our 5 rights again. So we're going to be giving, our right patient is Wanda Chi. The right drug is Meperidine. Right time is at 0900. Perfect. Right dose is 0.5 mLs, and the right route is IV push. Okay, so that is our drug check. And we're going to be doing 3 of them. We already did it when we're in person. So this is the 3rd one. And so after that, we're just, we flushed our 2 mLs, and we're going to draw up our Meperidine now. So we're going to grab our syringe and our needle. Okay. All right. Okay, so we're going to drop 0.5 mLs. We're going to put some air in. Let some air in to draw up of 0.5 mLs. And then we're gonna show you in the video. We're gonna show you, I'll show you right now. Okay. So now, all right, 0.5. Okay, perfect. All right. I drew up 0.5. And I have no medication left in this, so we're just gonna pretend I drew it up. So 0.5 mLs. It is perfect on the dot, not too little, not too much. Okay, so now we're just gonna safety cap our needle back, like that. Safety capped it. You don't touch it. You put it back on without touching the needle or risking yourself from sticking. Okay, so we got our 0.5. We did our drug check of right patient wanted Chi, the right drug meperidine, right time 0900, right dose 0.5 mLs, and the right route is IV push. Perfect. So we have that. We're going to tell our patient, we're going to be giving you meperidine. Side effects could be that lightheadedness, dizziness, nausea, and it is a pain medication for your pain. We did our third drug check in front of the patient. And no known allergies or anything. Then we're gonna remove the saline, flush 2 mLs. Okay, remove the saline. Okay, perfect. And we're gonna clean the tip of that with an alcohol prep pad. So it's ready. Okay, clean, clean, clean. Okay, it's ready. And so now we're just gonna go ahead. We're gonna remove the needle carefully. Okay, sharps container. Okay, so now we clean the tip and we tap the patient, everything, and now you're just gonna connect here. You're gonna push it slowly while looking at the patient and the time. Slow push, slow push. Okay, keep looking at the patient and the time. Okay, so now we're slowly pushing it. Slow push. Perfect. Okay. So then we unscrew it. We throw this away. Then we flush with a clean flush. We clean the tip again with an alcohol prep pad. Okay, and then we go ahead and make sure all the medication is being given. You flush 2 mLs to make sure that the patient receives all the medication. Make sure there's no air in the flush when you do that. Okay, perfect. Then you remove the flush. You make sure that the clamp is in place. You clamp the IV. Oh, sorry. Okay. All right. So that you give your medication. You tape the extension right here on the side of the patient because tape right here, just because it's gonna flail around and you don't want that. Okay, perfect. So we did it. We gave our medication and everything. And now you dispose of everything in the sharps container, the needles and stuff. You dispose of that. You clean up your area. You tell the patient, I'll be back in 30 minutes. And you dispose of everything. Tell the patient, I'm going to be back in 30 minutes to assess your pain. Bed is locked. Call item reach. Belongings are in reach. Tell the patient that you may feel these side effects, so call if you need to go to the bathroom. Any questions? Patient states no. Okay, bed locked in low position, side rails up. We remove gloves, wash our hands. After moving everything, make sure you put the med back in its designated area. Dispose of it properly. And now we just document. We're going to put the gauge. It was a 22 gauge catheter. We're going to state that we did the IV on the right forearm. We flushed well, and we gave 0.5 mLs of the meperidine, and no complications were noted. So your patient is safe. Everything is good. Everything is charted. You did your 3 med checks. And yes, so that is it. So thank you very much. We did it. We washed our gloves we washed our hands. Everything is done. Patient is safe. Yes, thank you.